Honestly, the easiest, more or less structure to find is just the medial ridge. You know, we can start from the spine and kind of work our fingers over until we find kind of the bony prominence of the medial ridge. And then you can follow it down until you get the inferior portion of it, inferior angle. And what you'll notice is that as tissue becomes more numerous on the scapula, it's going to get harder to feel. And so, you know, you can position the shoulder, have them kind of move it around so you can feel it a little bit better. But we'll just make a quick line. I'm just approximating down to about the inferior angle. And then as we come more laterally, you'll completely lose the scapula. It's just under a lot of tissue in that region. You can have him kind of move his shoulder kind of forward and back just to kind of see how the scapula moves. But then the neutral position is where you're going to be doing most of their palpation. And then we'll come up to the, let's talk about then, we'll also move into the coicoid process, the bicipital groove, and then different kind of areas of the lesser and greater tubercle where the rotator cuff muscle sets. And so as I'm feeling here, I'm going to start kind of midline of the clavicle to find the coicoid process. I'm going to kind of, now this, you have to push in a little bit more here, but I'm going to easily kind of push back towards kind of the scapula. And as I'm coming over, I'm just trying to feel and kind of almost scrape across. And what you're going to do is that the first, honestly, the first bony prominence that you're going to feel is going to be the coicoid process. So if I put a finger there, what can I do to make sure I'm on that and not on the humeral head? Move the shoulder. So I'm going to keep it here, just easy internal external rotation. It's not moving underneath my fingertips, so I'm good. So I'm on the coicoid process. Okay. So you can still, it's a little bit more red. There's a little bit more tissue to kind of get through, and it's definitely a pressure point. So you gotta be easy, easy on that area as best you can. So there, I'll get on the coicoid process. It's not going to be very big. Probably like the end of this dry erase marker, kind of as far as the diameter. Okay, so that you can feel at least. And so then I'm going to come on there, come to the other side of the coicoid process. And then I'll kind of fall into nothingness. So it's the space between the shoulder. So the coicoid process, there's a space between the shoulder, the humeral head, and the coicoid process. So I fall into that space, and then the next spot I'm going to hit is the humeral head. And so how do I know it's the humeral head? I'm going to hit the shoulder and feel for the movement. So after that, is a process of finding the lesser tubercle, the bicep, the bicipital groove, and then the greater tubercle as well too. Dr. Hackney has a great way to do this, and so I'll try my best to teach it like he does. So a lot of times, you know, coming from this direction, I can, if I find the coicoid process, I can kind of put a finger there, use another finger to locate the head of the humerus. Okay, so I'm on there, so I know I'm on there. So as far as identifying structures, the problem with the shoulder is that as it rotates in and out, some structures are going to be more visible than the others. So if you're thinking about it, if I rotate all the way out into external rotation, and I have my finger right on where the humeral head is located, what structure do you think that would be? What?
Lesser tubercle?
Lesser tubercle. So what attaches to the lesser tubercle? Subscap. So there's rotator cuff muscle, really number one. Okay? And so as I'm here, I'm keeping my finger there. If I just keep my finger there and I start rotating more to neutral, maybe a little bit past neutral just a tad, the shoulder also rotates as well. So what structure do you think I'm in now? I gave you a hint. Bicipital groove, right. So to identify that, so you can get it in some people you can't, but you'll actually feel where you're in the groove and feel the bicep tendon, okay? So you can actually feel for the tendon as you come So it's kind of like a thicker guitar string that you're kind of moving back and forth. But just a little pressure. And then as I bring them all the way into internal rotation, what's the next one? Greater tubercle. So there I am with the greater tubercle. You know, what two rotator cuff muscle attaches to the greater tubercle? What else? Supraspinatus. Good. Okay, so it's just a way to identify those. You'll get into more specifics about how to exactly find every single rotator cuff muscle to do cross-friction massage and stuff like that. But that's the basics of finding the lesser, the bicycle groove in the greater tubercle. It's just by simple rotating out or rotating out or rotating after you find the spot where the humeral head is at. Okay? All right, any questions? I know that's a lot. Do you guys still have your paper from the shoulder? Your lab paper somewhere? Okay. So follow those. They'll all be kind of on there. If I skip something, you know, don't worry about it. We'll just go over it on lab and let Dr. Hackey look at it. All right.